Good afternoon, Tour de Cure, Virginia. My name is Kobe Riley. I'm a pharmacist with Walmart Pharmacy. With me, I have Nathan Evans. And thank you for joining us today for segment 4, which is Ask Your Pharmacist. Nate, would you like to tell us a little bit about yourself?
Hey, thanks, Kobe. It's great to be here. Like Kobe said, I'm a pharmacist with Walmart. I've been with Walmart for 20 years in the pharmacy department, so I'm really excited to be here.
Awesome. Well, thank you for being here, Nate, and helping support the tour. We'll just jump right in. I'm going to ask you a couple questions. Is that cool with you?
Absolutely.
All right. We all think of pharmacists as the doctors who fill our prescriptions. What other services do pharmacists provide as key members of an individual's healthcare team?
Oh, that's a great question, Kobe. So pharmacists start off with every prescription that you fill. The pharmacist checks for potential and actual drug events. So if that drug is going to be working in your favor, they're going to check for that. Or if you've had any issues with it in the past, they're going to screen for that. They check for therapeutic duplication. So if your doctor writes you a prescription that's going to be for a medication that may be doing the same thing that another doctor writes for, they're going to identify that. We're going to check and make sure there aren't any drug or disease interactions. There's certain medications that you can't take with certain disease states. We also check and make sure that the dosage that the doctor writes for is correct for you. We check the frequency or the duration of the treatment. You know, if an antibiotic is given to you, is it the correct duration that it should be to cure your ailment? We're going to check for your drug allergies on every prescription. There's a lot of drugs in certain classes that someone may not be able to take, and you may not know it, but because it's a different name. We'll also check for any type of clinical misuse. If a medication is being prescribed outside of what it's actually used for, we'll check that. We also look for drug and drug interactions. So if one drug doesn't go well with another one, we check that. And then, of course, we're going to check for those pregnancy alerts. We want to make sure to keep the baby safe while the woman is pregnant. Some other services that we can offer, point of care testing. We offer those in pharmacies like glucose testing, cholesterol screenings, BMI, and things like that.
Excellent. I'm glad to know that they're looking out. So how else can a local retail pharmacies help individuals manage their diabetes and make sure they're best utilizing those medications?
Yeah, so retail pharmacists are probably some of the most accessible healthcare professionals around. You know, you don't have to have an appointment to come in and talk to us. You can just walk up to the window, you can give us a call. You know, there might be a short hold on the phone right now, but you know, if you come into the store, we'll be happy to talk with you. With that being said, pharmacists can offer suggestions around how and when to take diabetic medication. You know, some of them are taken a lot better with food, some without, and also may depend on the time of day that you take them. Set medications for diabetics have a high prevalence to cause GI distress. So we'll coach you through that and kind of give you some good pointers around that. The pharmacist may suggest taking medication at a different time of day. You know, if it upsets your stomach because you don't have anything on it, they'll have you take it maybe with lunch or something like that. Or we could suggest a change in the medication from your doctor to a different formulation. Maybe an extended release product may help that GI distress, and you may only have to take it once a day instead of several times a day.
Excellent. Good advice. What are some good tips to help patients remember to take their medications on time each day?
This is one of my favorite ones. So my favorite tool is probably one of the easiest ones. It's just the daily pill planner. So when used correctly, it helps maintain that adherence to medication. But it's a very simple tool, but there's a little training with it. So your planners normally have your 7 days on them. So we have what's called the leave open method. So you fill them up. Most of them are like a Sunday through Saturday situation on them. So you'll fill them up for the week. And then as you take the medications for the day, you leave that compartment open. So then when you see it, you know that that day is taken. And then when you come back the next day, that compartment's closed. So you know that medication hasn't been taken yet. So as you go throughout the week, once the compartment is opened and all of them are open, you know it's time to refill it and you're good to go. For my more digital patients, I like to recommend setting up reminders on their phone. There are also some really good apps out there that allow you to put your medications into them, and it'll send you little reminders and alerts when it's time to take them. And a lot of these medications will kind of do a daily diary for you. It'll kind of tell you when you take the medication and how many days you've successfully taken it. And then nearly all pharmacies will offer text messaging, when it's time for refills, and then again when the medication is ready for pickup.
Awesome. Yeah, the digital is really good to help keep people reminded, because most people want to take their medication, they're just busy and forget, right?
Right.
Yeah, we've also got that new Walmart wellness app that's out there. Hopefully we'll see that come into play someday.
Absolutely.
So what are some services the pharmacist can assist patients with beyond filling prescriptions?
So pharmacists are vaccine experts too. Based on your disease state and age, we can normally recommend which vaccines may be appropriate for you and then give them to you all in one visit. Based on your age, there are certain vaccines that are needed, and then different disease states will require different vaccines as well. Retail pharmacists may be also be able to check your blood pressure, blood glucose, BMI, cholesterol, or a diabetic's A1C if needed. Once they get your results, we'll often spend some time with you talking about ways to maybe lower some of those numbers, maybe through lifestyle changes, diet modification, or ask you to follow up with your physician for additional testing if needed. Pharmacists also are great resources for recommendations with over-the-counter products. We recommend things from dandruff shampoos to upset stomachs to healthy nutrition. Just about everything over the counter, we have a pretty good idea of what's going to work for you.
Awesome. Those have been some really good tips and advice, Nathan. I do appreciate you being here and supporting the tour with us today.
Thanks for having me, Kobe. Really appreciate it.
All right. Thank you, sir.